As the coronavirus grows, President Trump has suspended travel between the United States and most of Europe as the World Health Organization finally declared the coronavirus a pandemic.
Today, the World Health Organization officially announced that this is a global pandemic. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection. We will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. We are all in this together. We must put politics aside, stop the partisanship, and unify together as one nation and one family.
Of course, Democrat haters will hate as they claim President Trump has done nothing.
You have Donald Trump saying nothing to worry about here. Move along, just like the Chinese.
Yeah.
The 2019 to 2020 season of the NBA has also been suspended indefinitely after a player on the Utah Jazz tested positive, while the NCAA March Madness will go on with empty seats. Meanwhile, the first positive case involving a major celebrity has occurred in Australia as Tom Hanks and his wife Rita Wilson offered this statement to Deadline. "Hello folks, Rita and I are down here in Australia. We felt a bit tired, like we had colds and some body aches. Rita had some chills that came and went, slight fevers too. To play things right as is needed in the world right now, we were tested for the coronavirus and were found to be positive." Hanks and his wife are in their early 60s, the beginning of the age group that is strongly being warned to restrict themselves from public places as much as possible. And we are gradually learning of the effects of the virus on the lungs of those infected. As the Daily Mirror reported, these X-ray images show the damage that coronavirus is doing to the lungs of people who catch the potentially deadly bug. Doctors have been able to identify specific abnormalities caused by COVID-19, and the patterns are similar to those found in patients from SARS and MERS outbreaks. The scans show patches in the lungs, and the experts' findings could lead to a quicker diagnosis and help to prevent infections. The first person to catch the flu-like illness had previously told how it hit him like a train and left him suffocating and in blinding pain for weeks. Meanwhile, as The Hill reports, federally funded tests conducted by scientists from several major institutions indicated that the novel form of coronavirus behind a worldwide outbreak can survive in the air for several hours.
Well, SARS was also a coronavirus in 2002. It infected 8,000 people, and it killed about 775. It had a mortality of about 9 to 10%. So that's only 8,000 people. In about a year, in the 2.5 months that we've had this coronavirus, as you know, we now have multiples of that. The seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu.
Last week, Republican members of Congress were told that there's a good chance most people in the United States will eventually be exposed to the coronavirus. They weren't suggesting that most people will become infected or ill, but that most will encounter the virus. Meanwhile, the super rich, as expected, jet off to their bunkers, heading off to countries largely unaffected and taking their own personal doctors and nurses with them, just as we've been documenting for years. John Bound reporting.